So move
There's
this,
a
Madam Chair.
motion. Okay, thank you, Kong Rani. There's a motion to dispense the calling of the roll.
Second the motion.
Duly seconded. Is there any objection? Hearing none, then the motion is approved. Before we proceed, I'd like to call on Ma'am Sylvia for the opening prayer. Ma'am Sylvia.
Yes, ma'am. In the name of the Father, the Son, and the Holy Spirit, we thank you, Lord, for this meeting and the purposes you have set forth. We know that when we gather together, you are always with the divine agenda. Even in failed attempts, you blow us away with your faithfulness. And we humbly come before you again to ask for your divine guidance and wisdom so that this meeting will bring about changes that our country sorely need. All this we ask in the name of the Father. Amen.
Amen. We'll now proceed to the approval of the minutes of previous meeting. May we hear a motion?
Madam Chair,
Yes, Kong Jun.
I move to defer with the reading of the minutes of the previous meeting and the approval of the same. I so move, Madam Chair.
There's
I
a
second.
motion to dispense the reading of the minutes of previous meeting. And
I second po, Madam Chair.
duly seconded. Is there any objection?
Second, Madam Chair, second.
Hearing no objection, then the motion is approved. Would like to recognize first the presence of the following members. We have Representative Maria Fe Abunda, Representative our Vice Chair, Maria Lourdes Arroyo, Representative Ronnie Ong, Representative Gil Acosta, Representative Rodolfo Ordanes, Representative Ruth Mariano Hernandez, our Vice Chair, Representative Alberto Yao, Representative Yun Gato Jr., Representative Stella Kimbo, Representative Rani Abu, Representative Jose Ong, Representative Janet Garin, and Representative Tyron Agabas. For our resource persons, we have
Madam Chair,
yes,
excuse me, correction.
Rani.
I am an author, so that is the reason why I was invited on this meeting, but I'm not a
Okay.
member of the Committee on Health.
Okay, as an author of House Bill number 7408.
Thank you, Madam Chair.
Kong Rani. Our resource persons present for today's meeting. From the DOH, we have Dr. Carmela Granda, Ms. Rosemary Holandes, Mr. Rodley Carza, Ms. Jovi Raval, Director Marlene Pagayunan of FDA, and Mr. Roderick Napulan from HFDB. From the DTI, we have Attorney Marimel Parsionula. From the DOST, we have Dr. Milflor Gonzalez, Dr. Rosemary Dumag, Ms. Christine Biona Nacionales, and Mr. Carl Vincent Cabanilla. From Department of Agriculture, we have USEC Evelyn Labinya. From the DBM, we have Assistant Director Jane Abelia. From the DOF, we have Ms. Charmaine Odieta and Mr. Miko Ching. From TESDA, we have Mr. Clefford Pascual. From Nutritionist Dietitians Association of the Philippines, we have the President, Dr. Zenaida Velasco. From Philippine Association of Nutrition, we have Dr. Cecilia Acuin, their President, and Ms. Charmaine Trinidad. From Imagine Law, we have Ms. Sofia San Luis, the Executive Director, Ms. Maria Ann Rosales Santo Domingo, and Ms. Jeline Corpus. From Ignacio Lacson Arroyo Senior Memorial District Hospital, we have Dr. Maria Lalaine Teorima. And from Northern Samar Provincial Hospital, we have Dr. Joseph Eslao. From Hospital ng Palawan, we have Dr. Odi Cipriano, and Eastern Samar Provincial Hospital, Dr. Jessica Sabalberino. I also see Director Paz Sidianco of Region 4A DOH. Good morning again, everyone, and distinguished colleagues and our esteemed resource persons. Today, the Committee on Health will tackle our important pieces of legislation and 10 local bills. First in the agenda is the deliberation on bills protecting Filipinos from harmful effects of trans fatty acids. The four legislations we have today, House Bill number 7934, authored by this representation, House Bill number 7200 by Representative Alfred de los Santos, House Bill number 7202, authored by Representative Ronnie L. Ong, and House Bill number 8093, authored by Representative Luis Raymond L. Ray Villapuerte Jr. This covers trans fatty acids in common as its subject matter. This bill seeks to protect and promote the Filipinos' right to health by ensuring safe and nutritious food, free from substances like trans fatty acid or TFA that increase their risk of contracting deadly diseases and protect Filipinos from the threat of death and diseases linked to TFA consumption by removing the industrially produced TFA from the food supply. Specifically, it seeks to regulate the use of TFA or trans fatty acid by imposing penalties in the manufacture, importation, and distribution and sale of partially hydrogenated oils or PHOs and oils and fats with high TFA, and mandating the DOH to convene and lead the interagency task force on TFA to carry out the effective implementation of this act. Lastly, there are 10 local bills in the line or in line up for consideration of the committee, which involves increasing bed capacity, conversion, renationalization, which are important steps in our journey towards improving our overall healthcare system, which we need more than ever, now more than ever. Hence, this committee shall deliberate these bills in an efficient and expeditious manner with the end in view of paving way to the immediate delivery of essential health services to our people. Hence, as we proceed into the first item in the agenda, may I therefore turn over the chairmanship or the floor to our vice chair, Representative Marilu Arroyo, to preside while I deliver my sponsorship speech. Thank you very much. Kong Marilu.
Chair Helen Tan. And since I will read it, may we hear from the author of House Bill 7934, which will be known as the Trans Fat Free Philippines Act. Our chairperson, Angelina Tan, Doc Angelina Tan, for her sponsorship speech, please.
Thank you, Kong Marilu, our vice chair. Good morning again. I would like to put forward before this committee the regulation of the manufacture, importation, and distribution and sale of food products with high trans fatty acids or TFA. I believe that the explanatory note of my bill, House Bill 7934, provides significant details regarding relevant health statistics concerning TFAs, its dire consequences to health, and the need to regulate its use. Allow me to stress, however, as the principal author of this bill of Universal Healthcare Act or RA 11223, this proposal strongly echoes the need for the adoption of an integrated and comprehensive approach to ensure that all Filipinos are health literate, provided with healthy environment or living conditions, and protected from hazards and risks that could affect their health, as well as the provision of access to a comprehensive set of quality and cost-effective, promotive, and preventive health services. With this in mind, this measure seeks to curb the use of what has been dubbed as the tobacco of nutrition. In as much as TFA has no particular health benefits and is completely replaceable with no difference in taste or cost of food. I believe that this important piece of legislation is significantly urgent, especially during this time of COVID-19 pandemic, where patients with comorbidities such as coronary heart diseases have the higher risk of serious illness or death. It needs stressing that so many COVID-19 deaths in the country had comorbidities. Now more than ever, the need for preventive healthcare and healthy lifestyle promotion must be realized in line with the vision of universal healthcare. Moreover, it has been the position of the World Health Organization that TFA or trans fatty acid elimination is one of the simplest and most straightforward public health interventions to reduce the risk of cardiovascular diseases or CVDs and improve nutritional quality of diets. Hence, I urge this committee for the approval of this important measure and for the approval of this measure. Thank you so much, Madam Chair.
Congresswoman Tan, you have a great bill. May I manifest that I would like to co-author, please?
Yes, Kong Marilu, ComSec, please take note on the request of our Madam Chair.
And at this point, may we hear from our resource speakers, please? DOH, anyone that wants to speak, please.
Madam Chair, probably we can recognize other authors first.
I see. Go ahead. Do you want to take everything up first and then
Mad-
call the resource persons? Is this it?
Yes, Madam Chair. We can call first the authors of succeeding House bills if they are present. I think Representative Ronnie Ong is
Yes
present.
po, Vice Chair.
Yes.
Yes po, Chair. Yes po.
Kong Ronnie Ong of House Bill 7202, please proceed.
Thank you. Thank you, Chair. Thank you, Vice Chair. Good morning, Honorable Chairperson Helen Tan, my colleagues, resource persons, and staff present today. Dahil po sa COVID-19, mas nakikita po natin ang importansya ng kalusugan, ng strong immune system, and healthy lifestyle. This bill po that I filed is simply straightforward and will help us improve our health by improving our health by eliminating industrial produced trans fatty acids or TFA, dubbed as the tobacco of nutrition, which significantly increases the risk of contracting heart disease and consequently of dying from COVID-19. As of June 8, 2020, 49% of COVID-19 deaths in the Philippines had comorbidities such as cardiovascular disease or CVDs that are linked to TFA, which unfortunately is part of our food intake. I'm looking forward to the comments of our expert, particularly how we can transition to totally eliminating TFA, if it is doable or advisable, and what are the alternatives if we remove industrially produced TFA products or partially hydrogenated oils and fats. I ask all the stakeholders, including experts and affected industries, to find the right balance and timing in finally making the Philippines trans fat free. Maraming salamat po. Thank you, Chair. Thank you, Vice Chair.
Ma'am, after Kong Ronnie Ong, may I please turn over the floor back to you, Congresswoman Tan?
Thank
Madam
you
Chair,
to our Vice Chair, Kong Marilu Arroyo. Yes, Kong Rani.
can I sponsor the measure filed by Representative El Rey Villaferte because he asked me to to please represent him sponsoring his House Bill number 8093. And just wanna say that the explanatory note of House Bill 8093 be on record as his sponsorship speech.
Okay, thank you, Kong Rani, for
Thank you.
sponsoring House Bill 8093, authored by Representative El Rey Villafuerte. Do we have Representative Alfred de los Santos on House Bill 7200? Is there anyone who wants to sponsor the bill of Representative Alfred de los Santos?
Chair, I think it's similar to my bill,
Okay.
so we can share the same sponsorship speech.
Thank you, Kong Ronnie. We'll now proceed to the discussion. May I call on representative from the DOH, from DPCB, or Disease Prevention and Control Bureau, Director Aleli Ani Sodiakal. From the DOH.
Good morning, Mom.
Good morning, ma'am. Please
Director
proceed.
Helen po is not available po for this meeting. We were asked to represent her po, ma'am.
Okay, kindly proceed. Please introduce yourself.
Okay. Good morning, everybody. I'm Rosemary Hernandez from the Disease Prevention and Control Bureau, Lifestyle-Related Diseases Division of the Department of Health. And I would like to read po our DOH position paper regarding the Transpac-Free Philippines bills. The Department of Health supports the passage of these bills, which aim to address the rising prevalence of non-communicable diseases in the country. The tobacco, nutrition, trans fatty acids have no health benefits and are completely replaceable with no significant difference in taste or cost to food. Apart from being entirely without benefit, PFAs are a dietary risk factor, increasing the risk of coronary heart disease, cancers, type 2 diabetes, autoimmune diseases, and other non-communicable diseases. In the Philippines, 7 of the top 10 leading causes of death are NCDs. Many deaths from NCDs are premature, occurring between the ages of 30 to 69. Thus, to eliminate, or at the very least, control TFAs in food may improve health outcomes. The World Health Organization notes that the elimination of industrially produced TFA is one of the simplest public health interventions that can address the prevalence of NCDs worldwide. It is for this reason that the DOH supports the passage of these bills in contribution to the global movement to become TFA-free by 2023. Respectfully, Francisco T. Duque III, Secretary of Health.
Thank you. From the FDA, may we hear from Director Marlene Pagayunan?
Good morning. Good morning po, Chair. Hello po.
Please proceed,
FDA
Director.
also is FDA is also supporting the bill, the passage of the bill, and actually part of our comments are submitted to the Department of Health for the transmission to the your office po. So there are comments lang po regarding yung mga definition. So I don't know if we were informed by the Legislative Liaison Office that our comments was part of the submission for the House Bill 720 and 72002. And for the other bills pong the 2, 8093 and 7. 3.4, if we can allow also, if we can submit some comments on the definition of terms, and also the like the FBO in one of the bill there is a definition, but on the other bill there's none po. So maybe we could integrate the 4 bills to come up with one bill po. Thank you, ma'am. Thank you.
Thank you, Director Marlene. From the NNC, or National Nutrition Council, we have Ms. Jovi Rabal, the Chief of Nutrition Information and Education Division.
Thank you very much, Madam Chair. The National Nutrition Council fully endorses the House Bill 7200, 7202, 7934, and 8093, and we recommend for the immediate passage of these bills. The NNC has agrees with its role as member of the interagency TFA task force under Article 2, Section 5. And we also recommend for the inclusion of technical experts aside from the government agencies. We also have minor other comments on the particular sections, but we do agree that the heavy and trans fat-free Philippines will be progressive as found in the version of House Bill 7202 and 8093. We recommend that the removal of TFA, since this will take several years, and the use of progressive will provide assurance to food manufacturers, distributors, and establishments that they are given time to comply with the law. We will be submitting our position paper to the Committee on Health, Madam Chair, but the National Nutrition Council supports the passage of these bills. Thank you.
Thank you. We'll now call on representative from FNRI.
Good morning, Madam Chair.
Imelda Agdepa.
Good morning, Madam Chair. I'm Milflor Gonzalez po, Doktora Agdepa.
Please proceed, ma'am.
We also support the passage of the bill. And as a Research and Development Institute of the DOST, we have conducted several studies, and we recommend that more refined exposure assessment studies for more accurate exposure assessment and risk characterization of the population to TFA be continuously done. But we support the bill po. Thank you, Madam Chair.
Thank you, Dr. Gonzalez. From do we have representative from Imagine Law?
Yes, Chairperson Tan. Good morning, everyone. Good morning. I am Attorney Mary Grace Ann Rosales. I'm Project Manager of Imagine Law. And as public interest law organization working towards the development of public health policies, we fully endorse and support the bill. We'd like to congratulate you, as well as Representative Ong, Representative De Los Santos, and also Representative Villafuerte for sponsoring this bill. And we'd like to highlight also that this bill is truly life-saving, and as much as it is aligned with the World Health Organization Replace Action Package, it also brings to forth safeguards and protections for health for all Filipinos, as well as putting us at a world-class level. So thank you very much, Chairperson Tan.
Thank you, Attorney. From the Nutritionist Dietitians Association of the Philippines, Dr. Zenaida Velasco, their president. She with us, Ma'am Sylvia.
Ma'am, sandali pa. Good morning, Madam Chair.
Hey, good morning,
ma'am.
ma'am.
Supports the 4 bills filed in Congress, and this is targeting the exogenous sources of TFAs that we find in industrialized processed foods. And therefore, we also believe in the importance of nutrition education so that in collaboration with the other stakeholders, we may be able to advocate positive behavior change among consumers. So thank you, Madam Chair, and to all the sponsors of the bill. Congratulations.
Thank you, ma'am. From Philippine Association of Nutrition. Is this-
Good morning. Good morning po. Wala na po si Dr. Ces Akuin.
Okay,
Uh,
ma'am.
Ako po si Maria Lourdes A. Vega, First Vice President ng Philippine Association of Nutrition. And kagaya ng mga nauna sa amin, we also express our full support for the passage of the bill, noting that it addresses the need to address the harmful effects of trans fatty acids in human health and making the Philippines part of the global call to eliminate the use of TFA in processed foods. We have reviewed the provisions of the bill and in general find that most of the provisions lay out clearly the policy and how it will be implemented effectively. We have little suggestions which we will submit formally to the committee, but some of these including the local government units in the representation of the group that will manage the entire effort. Also, finding ways to protect our coconut farmers. So that could mean including research on possible use of coconut oil as replacement, although there's not much literature on that yet. And then for the information and education campaign, we also suggest that we include something on the proper use of cooking oil. We know that reusing cooking oil also adds TFA. Of course, the TFA in processed food is higher than what happens when you use cooking oil. But we think that this is one important aspect that has to be part of the legislation. So we support the TFA elimination effort. And of course, we need to convince our other partners, and we hope that the committee will have information on products in the Philippines that use the PHO or the hydrogenated oils, alternatives in food products, the costs, and the potential impact on related morbidity and mortality, so that we can really lay out a very convincing case for the legislation. But we'd like to say we fully support the bill, and we thank all the legislations for taking this up. And we hope na we can really push this to become a law within this term. Maraming salamat po, Congresswoman and the other legislators.
Ma'am, can you give us an example ng partially hydrogenated oil?
Ito po yung mga ginagamit ngayon. Yun yung i-replace natin sa mga existing products.
So, an example in the market na common to the Filipinos for the benefit of our viewers.
That usually kasi cakes, biscuits, yung ganyan, yan ang mga may PHO. Kaya lang lately I've been looking at product labels, and some of them have actually done away with PHOs. Now I don't know if the attorney from Imagine Law would have specifics on this, and maybe she can answer your question.
Attorney from the Imagine Law.
Yes, Chairperson Tan.
Yeah, this is for the benefit of those watching. We are, I think, live on Facebook.
Thank you. Thank you, Chairperson Tan, for giving us this opportunity. So practical examples that you can see of partially hydrogenated oils are, for example, your margarine and your shortening. So it's because the process of partial hydrogenation, the introduction of hydrogen into liquid vegetable oils, turns it into a semi-solid form. So by being semi-solid, it becomes spreadable. So it also extends the shelf life. And that's the basic uses of PHOs when it was first introduced. But fortunately, when the health impact of PHOs and trans fat in general was brought to light, healthier alternatives are also provided, and it still yields the same benefits.
Thank you, attorney.
Thank you.
So most of the foods that we are eating, no, ay merong fatty acids.
Yes, Chairperson Tan. But what should be noted here is that the same food that we enjoy, the same food that we eat, shouldn't have trans fat, and we should still be able to enjoy them. It's just that a regulation must be in place.
Okay. Thank you, attorney. Maybe call on representative from DTI, Attorney Marimel Parsionola. From DTI.
Yes. Good morning, Ms. Chair. Good morning.
Good
This is
morning,
Attorney
ma'am.
Porciuncola. Yes, the DTI, particularly the Consumer Protection Advocacy Bureau, supports the intention of the proposed House bills because it is a measure to ensure the promotion of right to health of Filipino consumers. It supports regulating the availability in the market of TFAs and foods high in trans fatty acid, as it would reduce the consumption by the Filipinos, which will augur well in avoiding coronary heart disease and will save lives. And it also supports the use of healthy alternative oils and fats over trans fatty acids. Also, the prohibition on trans fat-free claims by suppliers, as consumers have the right to correct and complete information to make informed purchase decision. It also suggests that nutritional value be included in the packaging. It further supports the testing of TFA content in foods. However, it suggests to rephrase Section 22 of Article 6 to read, the DTI tab or the Philippine Accreditation Bureau, in cooperation with the FDA, shall accredit public and private testing facilities. This office opines that there should only be one government agency accrediting public and private testing facilities, plus the fact that double accreditation by two agencies for the same purpose is an added burden to the testing business. It suggests ensuring heightened awareness among Filipinos, consumers, and business alike on the negative impact on health of consumption of food high in trans fatty acid. It suggests too that a creation of awareness about TFAs and its harmful effects on health be included in the education of children as early as in grade school. It also supports policies banning industrially produced TFAs and its use in the food supply. It agrees that the FDA and the LGUs enforce the provisions of the proposed act. This office puts forward strict enforcement to ensure compliance of manufacturers, importers, sellers, and all food business operators to the provisions of the proposed act. Further, while we agree that prohibiting TFAs in the food supply is urgent, may we suggest that in the passage of the proposed House bills, study and evaluation be conducted first to determine the country's readiness to implement a trans fat-free Philippines. But lastly, in view of the technical issues involved, this office defers to the Department of Health's Food and Drug Administration, as it is the government agency which has jurisdiction over the matter. DTI Consumer Protection Group, on the other hand, welcomes any legislation that is for the protection and best interest of our consumers. It is also ready to jointly work with other government agencies to pursue legislations that promotes consumer welfare. Thank you very much, Madam Chair.
Thank you, ma'am. Do we have a representative from PCA?
Madam Chair.
Hi, Jen.
Madam
Our
Chair.
administrator. Yes, sir. Please proceed, sir.
Good morning, Madam Chair, Your Honors. Thank you for giving us this opportunity, and thank you. And we support and commend your representation and the members of the House of Representatives for sponsoring this bill that aim to regulate a healthier food chain supply by prohibiting the manufacture, importation, distribution, and sale of partially hydrogenated oils and oils, fats, processed and pre-packaged food with high trans fatty acid content. And this is very timely considering that the world is experiencing health threats and becoming aware of the importance thereof. As such, the authority deemed it timely that with this proposed legislation, coconut oil as a healthy alternative, plant-based oil, be emphasized and given due recognition, considering that the Philippines is among the top coconut growers and as well as the producer of coconut oil. In fact, the only oil that we export and contributes to $1 billion worth revenue. And we recommend the inclusion of coconut oil as a healthy alternative for the following reasons. One, that coconut oil being high in saturated fatty acids, 60% of which is medium chain fatty acids or MCFA, make it a highly stable oil to last for a long period of time on its natural state and does not have to go through the process of hydrogenation. Two, coconut oil is a healthy oil that increases metabolism, prevents Alzheimer's and other neurological disorders, boosts immune system, keeps sugar in check, and many more. As we have heard last week, DOST led the research, a clinical study found the usefulness of virgin coconut oil as an effective food supplement to control the symptoms of COVID-19. And third, the coconut oil is also referred to lauric oil since it contains approximately 40 to 50% of lauric acid of the overall fatty acid composition. And the significant presence of lauric acid plays an important role in making coconut oil chemically unique among other oils. And of course, we also would like to suggest or manifest our intention to be part of the implementation of the provisions of this act as part of the interagency task force, for PCA being the chairman of the National Code Organization of the DA Subcommittee on Fats and Oils, and PCA being mandated to promote the rapid integration, development, and growth of the coconut and other palm oil industry. And PCA, through its research and development capacity, can provide coconut and oil quality assurance and technology development support. Thank you very much, Madam Chair.
Thank you, sir. Sir, currently may ongoing deliberation ng COCO levy bill. And part of the provision there is on research and development. Baka specifically, we can add on that part yung use further study ng coconut oil as cooking oil.
Yes, Madam Chair. I will be there this afternoon during the plenary.
Okay, thank you, sir. Thank you so much, sir. I'd like to call on representative from DBM, Miss Grace Darunday, or from the DBM.
Hello, ma'am.
Hi, I'm Jane.
Good morning. Yes, ma'am, Your Honor. Ma'am, we would like to inform you, ma'am, na ang ni-refer na ho sa amin ng aming Department Liaison Office are those bills pertaining to the renationalization, the conversion, upgrading of hospitals.
Ma'am, we'll just forward you the bills and kindly comment na lang and submit it to the committee.
Okay, ma'am, noted.
Okay, thank you. Sorry about that.
Yes, ma'am.
Do we have representative from the World Health Organization, Mr. Tyrone Aquino? From the WHO. Okay, from the DFA, do we have guests from from DOF? Sorry. Department of Finance.
Madam Chair, good morning. This is Charmaine Odicta from the Department of Finance. For the DOF, ma'am, we're still drafting our official position paper, and it will be subject for approval by the Secretary. We note that Section 25 of the bills proposes for the tax and duty-free importation of TFA testing laboratories. However, we recognize the noble intention of this bill. Madam Chair, we would like to be clarified on the specific section if this importation will be done by the regulatory government agency such as FDA, since are they the one who will do the TFA testing?
Ma'am, FTA and DTI.
Okay. Thank you. We will be submitting our official position paper as soon as possible.
Thank you, ma'am. From the Department of Agriculture, Bureau of Agricultural Research, we have Director Mamaril.
Hello, ma'am. Good morning, everyone.
Good morning.
So from the Department of Agriculture, we highly support the provision of the bill, specifically Article 2, Section 8, where the Department of Agriculture will have an investment on research related to oilseed crops. And related to this, we can submit already to the FNRI to consider the following crops as alternative sources of oil. And these are peanut, which we locally produce, and perhaps soybean as well. But at the moment, perhaps FNRI, DOSC FNRI, and the DA can collaborate on peanut, since we have a good peanut production in the Philippines. And this could be one of the possible crops that could be prioritized for production of healthy cooking oils or healthy oil for that. Thank you very much, everyone. Merry Christmas na din po sa ating lahat.
Thank you, Director Mamariel. Merry Christmas din po. I think we're able to call now all the resource person. Is there anyone?
Yeah, Madam Chair, this is from DA po, for the high value crops po, under Secretary Evelyn Lavinia po.
Yes, Ma'am Yusek Evelyn.
Yes po. Okay, thank you very much, Madam Chair. We already read and reviewed the provisions of the bill, and we agree to support this bill, which we think are long overdue because of the human and socio-economic damages that unfettered and intrusion of the TFA into our food have inflicted to the population over the years. The final version, which also likely will be almost identical to all of the four proposed bill po. And would like to comment lang po, it must also be studied and established that the new technologies and method to produce more stable oils at room temperature for various usages, such as the intensification, would not already correct the malady in a major way. It is very likely that food manufacturers would get around this law or adapt into it by simply altering their processes. Although if they are successful in doing that, it might sufficiently already comply with the essential objectives of the intended law. And as our assignment po, high value crops po yung naka-assign po sa akin, there are about 9 oils, possible seed oils that are of use. As what Director Choi said earlier, that we have ground peanuts and soybean, and we're really pushing also for the coconut oil, as what mentioned by Director Madrigal of the PCA. At present po, our peanut and soybean oil is not that much, but we have it here in the Philippines. And we're pushing for both. If the experts find it really for more, for production, then we will undergo it in massive production on field. Seeing it studied in Afghanistan, the soybean also gives a lot of a good protein for the body. So baka either of the three, coconut oil, ground peanut, and also the soybean would be used for this, as the expert would tell us which one is really the best. Then we will undergo the massive planting of these commodities. Thank you.
Thank you, Yusek Lavinia. That's good to hear, no? Kasi it will give opportunities to our farmers. Kasi kung makita natin ang peanut and coconut oil or the soybean, but yung peanut and the coconut kasi meron tayo niyan, no? Ang laking opportunity for our farmers.
Ma'am, for info lang, we also have the best soybean here in the Philippines. Our top is Caraga, and it's a very good, it's a Manchuria, and we have a very extensive study already of the soya bean in the Philippines.
Oh, that's
Thank
good
you
to
po.
hear. Is there anyone who wants to speak on these bills? Meron pa po ba tayo ng mga resource persons na hindi natawag? If not, can we ask any members? Meron po kayong clarifications or inputs on these bills?
Madam.
Yes, Kong Hill.
Hello.
Kong Hill.
Positive response from our distinguished guest, Madam Chair.
Yes.
I move for the consolidation, and Madam Chair, having...
Kong Hill, medyo nawawala yung audio. Anyway, I think Kong Ronnie, are
Yes,
you
po.
amenable that we approve this bill in principle, subject to consolidation and amendment?
Yes po. Yes po, Chair. Yes po.
Okay.
Thank you.
Thank
Madam
you,
Chair.
Kong Ronnie. Kong Rani?
Reiterating the motion of Representative Acosta Jr. and with respect to various comments and suggestions made by the different agencies, and most of these suggestions can be incorporated to the implementing rules and regulations. And with respect to the DBM comments, no comments yet. If there, I think there's no provision about appropriation on that of those four measures. And with respect to the Department of Finance final comments subject to the approval of their principals, I think the four measures will be subjected to hearing in the Committee on Ways and Means, and the matter can be tackled on the Committee on Ways and Means. Is it right, Madam Chair? Is it right? Because all measures that have tax provisions is subjected to hearing at the Committee on Ways and Means.
Yes, after we
on that note, Madam Chair, I would like to reiterate the motion by Representative Acosta to approve, to consolidate the four bills subject to styles. The four bills move for approval.
Okay. Thank you, Kong Rani Abud. There's a motion to consolidate the four bills and also approve, subject to style and amendment. Can we hear a second?
Second.
Second po. Second.
Duly
Chair.
seconded. Is there any objection? Hearing none, then the motion is approved. Thank you to our resource persons and authors of this bill. We'll now proceed to the next agenda, which is the consideration of different local bills. For House Bill number 5688, authored by Representative Tyron Agabas, entitled An Act Increasing the Bed Capacity of Eastern Pangasinan District Hospital from 150 to 250 beds, upgrading its services and facilities, authorizing the increase of its medical personnel and appropriating funds therefore. Representative Tyron.
Yes, good morning, Madam Chair. Before I proceed to my House bill, may I request that I may be made a co-author of the previous bills, consolidated bills? Madam Chair.
Yes, Kong Tyron. Comsec, please take note on the request of Honorable Agabas.
Madam Chair, may I also request that the explanatory note in the proposed bill, House Bill number 5688, be adopted as my sponsorship speech, and that may I request the Chair and my dear colleagues to support the passage of the bill, this committee level, because of its importance, knowing fully well that all measures now are geared towards the uplifting of quality health services in the countryside. So move, Madam Chair.
Thank you, Kong Tyron. May we hear from the Department of Health? Sir Rod Napulan.
Thank you, Madam Chair. Good morning, everyone. Good morning, members of this committee and as well as colleagues in the government sector. Madam Chair, I would like to clarify lang, Madam Chair. The intent of this bill is to increase the bed capacity of the hospital under the local government unit still.
Yes, yes, Madam Chair.
Okay. With this, Madam Chair, we interpose no objections to the upgrading of the hospital as well as the increase in bed capacity. However, Madam Chair, we would like also to just to manifest that the DOH is currently undergoing study in terms of what is the appropriate bed capacity for each level. So with this, Madam Chair, we would like to suggest, Madam Chair, for the future increases of the hospital, we would like to refer the appropriate bed capacity to the Department of Health based on each hospital development plan, as well as to other parameters such as the increasing population, the burden of diseases, as well as the improvement of the healthcare provider networks, the facilities within the area. With this, Madam Chair, although we fully support for the intent of this law, but as to the appropriate bed capacity, Madam Chair, we defer for the to each hospital development plan, Madam Chair, based on the study that WH will be conducting. Currently, the study is already ongoing, and we're expecting, Madam Chair, to finish it by the end of the year or early next year, po, Madam Chair. Thank you, po, Madam Chair.
Madam Chair, may I respond?
Yes, Kong Tyron.
Well, without prejudice to the study currently being conducted by your office, I believe that previous studies evaluated valid classification and upgrading of the subject hospital EPDH to the maximum number of 250 bed capacity. I believe that a pre-evaluation has been made considering the geographical area of the district hospital, catering to about 10 municipalities with a population of more than 500,000 population. With the consideration of the bill in the early passage of this bill, it will also decongest other hospitals like the Baguio General Hospital, Region 1, and other tertiary hospitals from patients coming from a district. So the urgency of the passage of this bill cannot be overemphasized, Madam Chair. But of course, we cannot, of course, I will give due respect to the current evaluation being conducted by DOH. But just to manifest that the district hospital is fully qualified for the proposed bill, Madam Chair.
May I add just
Rod, clarify ko lang kasi the bill of Representative Tyron is a local bill.
Local
Itong
bill.
hospital is run by provincial government. Tama, Kong Tyron?
Yes, Madam Chair, that's correct. It is run by the provincial government of Pangasinan.
So, yung bill niya kasi increase on bed capacity. Are you suggesting na hindi naman kailangan dumaan pa sa legislation? They can just refer on the health development plan of the local government.
Yes, Madam Chair, it should also be considered part of the local investment plan for health. Although I think I understand based on the proposal for this upgrading of the hospital, that the capital outlay will be charged to the national government through the Health Facilities Enhancement Program, Madam Chair. And just to add, Madam Chair, I agree with Kong Agabas for raising up, because the Eastern Pangasinan District Hospital actually is already implementing almost 200 patients daily. So kung looking into the projections for upgrading of the hospital, although nasa level 1 po kasi siya, Madam Chair, that's why we have some reservations for the appropriate bed capacity. Kasi nga po, the DOH together with the DBM issued out a standard for each of the level, and yung ang existing guidelines po kasi ng DOH and then DBM based on the personnel services is nasa 75 beds lang. So parang that's why we, as advice of our undersecretary together with also as concurred by our director, na we need to study further kasi wala po kasing appropriate bed capacity for a 200 beds na level 1. So baka it's not all about increasing the bed capacity. Maybe we can consider also the upgrading as to their service capability. Capability pertaining to the each level. Kasi right now ang hospital is nasa level 1 capacity pa po siya eh. So maybe for future development of the hospital, be considered to upgrade that to secondary.
Sir Rod, ang problem dyan sa position nyo, ang dami ko nang na-approve sa committee na similar proposal, no? And so parang medyo late yung study na ginagawa ninyo, and we cannot differ naman the approval of the proposal of our congressmen on this, no? So hindi naman po pwedeng retroactive yung magiging findings ninyo kasi naipasa na namin. But for purposes of passing this proposal of Representative Tyron Agabas, we cannot wait on your position, no? Kasi I don't know how long your study, yung kino-conduct nyo na study on this one. Okay? Since still, ito naman ay to be funded by the local government unit, walang magiging masyadong impact sa inyo except yung support ninyo sa local government on HFEP. Okay? Infrastructures and equipment. Okay, thank you. Can we hear a motion for the approval of this bill? Kong Hill?
Madam Chair, I move for the approval of the measure sponsored by the distinguished gentleman from Pangasinan, Representative Tyron Agabas, Madam Chair.
Second the motion.
There's a motion to approve House Bill 5688, duly seconded. Is there any objection? Hearing none, the motion is approved. We'll now proceed to House Bill number 6372.
Madam Chair,
by yes, Kong
I just would
Tyron.
like to thank you for your support to my bill, and also Kung John Gato and Kung Hila Costa. Thank you so much.
Thank you, Kong Tyron. Congratulations. For House Bill number 6372, authored by late Representative Marisa Andaya, now being taken care by Representative Michael John Duavit. Do we have Kong Jack? If none, Kong June, can you sponsor please the bill of
Madam Chair.
Kong Jack? Yes, po.
In behalf of late Congressman Marisa Andaya, and now under caretaker Representative Michael John Duavit, I wish to sponsor House Bill number 6372, entitled the Act Renationalizing the Ragay District Hospital and Sipocot District Hospital, located in the municipalities of Ragay and Sipocot, Camarines Sur, placing the same under the control and supervision of the Department of Health and appropriating funds therefore and for other purposes. And I also move that the explanatory note will be served as her sponsorship speech. I so move, Madam Chair.
Thank you, Kong June. Sir Rod, may we hear
Madam Chair.
comment from you? Yes, Kong Rani.
Madam Chair, with due respect to the Department of Health, to Director Rod may we request the committee in memory of the late Representative Marisa Andaya. Let us defer the discussion about the merits of the House Bill and let us now proceed for the approval at once by this House Bill 6372 with respect to the late Marisa Andaya as our gift to her.
Okay.
Second the motion, Madam Chair.
Okay. There's a motion to approve House Bill 6372, duly seconded. Is there any objection? Hearing none, the motion is approved. We'll now proceed to House Bill 6391, authored by Representative Paul Ruiz Daza, Jose Jun Ong, our majority leader, Ferdinand Martin Romualdez, and Representative Yeda Marie Romualdez.
Good morning, Madam Chair.
Yes, sir. Please proceed.
Actually, I would just like to request the Chair to defer the consideration of this bill because I just received the consideration of this bill because I just received communication from the Provincial Health Board of Northern Samar that it would be introducing certain new provisions to this bill.
Okay. Thank you, sir. As from the author himself, House Bill number 6931 will be deferred for its consideration and approval.
Thank you, Madam Chair.
House Bill 6479, authored by Representative Hill Acosta, entitled An Act Increasing the Bed Capacity of Hospital ng Palawan in the City of Puerto Princesa, Province of Palawan from 100 to 400 beds, upgrading the service facilities and professional healthcare therein and appropriating funds therefore. Kong Hill, you can proceed.
Thank you, Madam Chair. I move that my explanatory note be adopted as my sponsorship speech regarding this bill, Madam Chair, and ask my committee members, co-committee members for the approval of the same, Madam Chair. Thank you.
Thank you. Can we hear from Sir Rod Napulan?
Thank you, Madam Chair. So this is Department of Health Hospital. Madam Chair, we are fully support for the increase in the bed capacity of the hospital ng Palawan. Without prejudice, Madam Chair, on the proposed measure on that DOH hospital bed capacity and service capability Rationalization Act of 2019, wherein it's already at the Senate for approval na po sa second reading. With this, Madam Chair, although Hospital ng Palawan right now is a level 1 hospital and we believe that it's high time na po to improve the facilities for the Hospital ng Palawan. So with this, Madam Chair, we fully support on this without prejudice on the approval of the bed rationalization for the DOH hospitals, Madam Chair. Thank you, Madam.
Thank you, Sir Rod. May we hear a motion for the approval of this bill?
Madam Chair,
Ong June.
I move that House Bill number 6479, authored by Representative Hill Acosta, be approved subject to style amendment. I so move, Madam Chair.
Second, Madam Chair.
Second.
The motion to approve House Bill 6479 subject to style and amendment duly seconded. Is there any objection? Hearing none, the motion is approved. We will now proceed to House Bill 6828, authored by Representative Maria Lourdes Arroyo, entitled An Act Increasing the
Thank you.
Bed Capacity of Ignacio L. Arroyo Senior Memorial District Hospital from 25 to 100 beds and appropriating funds therefore and for other purposes. May we hear from our Vice Chair, Representative Marilo Arroyo.
Madam Chairperson, my colleagues in the government, resource persons, good morning. It's a chilly good morning today. Thank you, Madam Chair, for including House Bill 6828 in today's agenda. Considering the current mismatch between the patients and the hospital's current infrastructure, this bill seeks to increase the capacity of the Ignacio L. Arroyo Senior Memorial Hospital in Isabela, the 5th District of Negros, from 25 beds to 100 beds. Hence, may I request this honorable body for the approval of House Bill 6828. I would also like to mention that in relation to my bill, there is also a pending bill in your committee, Madam Chair, which is House Bill 6963, seeking for the renationalization of Ignacio Arroyo Hospital Senior from a Memorial District Hospital, bringing it to the supervision and management of Health, to the Department of Health. Also in attendance is the Chief of the Hospital of Ignacio Arroyo Lacson Senior Memorial District Hospital, Dr. Lelaine Diorima, to enlighten us more on the need to increase the bed capacity in our hospital in support of House Bill number 6828. Thank you, Madam Chair.
May we hear first from Sir Rod Napulan.
Thank you po, Madam Chair. Madam Chair, would like to clarify lang on the intent of the bill. It's more of the increasing and upgrading the capacity of the hospital under the local government unit. Tama po ba, Madam Chair?
Yes. Yes, ma'am.
Kong Marilu?
Yes.
You mentioned you have same bill or a bill on same facility on renationalization?
Yes, that I filed it July 4, 2020 or 6 months ago.
Okay.
I have, Madam Chair, I have
Yes.
also spoken to Mr. Napulan, informing him of this many months ago before COVID.
You wanted, Kong Marilu, that this bill is not just an increase on bed capacity, but also to renationalize it.
Yes, yes,
Okay.
ma'am. Yes,
Sir
ma'am.
Rod, you can proceed.
Thank you po, Madam Chair. So it's clarified po that this bill will renationalize the hospital from the provincial government of Negros Occidental to the Department of Health. So, Madam Chair, just to before I proceed, Madam Chair, with our comments, would like to update, Madam Chair, on the meeting that was conducted by the committee, Senate Committee on Health and Demography last December 1, 2020, as joined by Kong Dimaporo, Office of the Senator Bongo, as well as the COMSEC from the House of Representatives Committee on Health. So, Madam Chair, it was, although the DBM was also part of the meeting also, by the way. Madam Chair, it was discussed that the proposed amendment on the specific provision on the appropriations, kasi as we recall, Madam Chair, that the good Congressman Dimaporo asking for a amendment on the specific provision on the IRA, on the Internal Revenue Allotment, that the House of Representatives also approved on his bill. So nagkaroon po ng discussion on this, and it was cleared out, although the final version is not yet issued out from the Committee on Health of the Senate, but the agreement was that the a provision will be introduced and amendments will be introduced at the Senate po, and it will consider po the following. One is the transition plan, that wherein that there will be a transition from the LGU's operation to the Department of Health. And while there's a transition po na ongoing, the funding of the hospital in terms of operations will be meantime charged to the local government unit, while there's no funds available or provided in the GAA, in the General Appropriations Act. So
Sir
yun
Rod,
po yung
Sir Rod, if I may interrupt you, no, based on yung meeting yesterday ba yan?
December 1 po, Madam Chair.
December 1, on the issue of Representative Dimaporo's proposal on House Bill 7322. You mentioned on the transition that your position is still that the fund should be chargeable to the LGU while on transition, right?
Yes,
But
Madam.
the proposed wording of Representative Dimaporo, which you accepted, is, I think, different from your position. Ang wording niya is the DBM in consultation with the DOH and the provincial government of Lanao del Norte shall determine the cost of renationalized functions relative to the operations of that hospital from its current era and cause the allocation of the same to GAA thereafter. Pero sabi mo determine.
Thank you, Madam Chair, for clarifying this, Madam Chair. That's the proposal of Kong Dimaporo po, Madam Chair. But as we discussed po together with the Senate COMSEC po, Madam Chair, there will be po a finalization po of the provision, and we're still awaiting po from the Committee on Health from the Senate po for the final version of the provision.
Okay, Sir Rod. So, we can just fix the APRO provision at the Committee on APRO. Okay? So, Kong Marilu, do you want the Chief of the Hospital to speak up on this bill?
Yes,
Yes.
please.
Please proceed. May we call on the Chief of the Hospital of Ignacio L. Arroyo Senior Memorial District Hospital?
Her name is Director Teorema.
Director Teorema. Director, you have the floor. Director.
I think you're muted. We can't hear you. I think you're muted, Director Teorema.
Okay. The Director, I think wala siya, tita. May we hear a motion for the approval of this bill? Kong Jun?
Madam Chair, I move for the approval of House Bill 6828, authored by Vice Chair Congresswoman Malu Arroyo. An act increasing the bed capacity of Ignacio Arroyo Senior Memorial District Hospital from 25 to 100 beds and appropriating funds thereof, subject to style and amendment. I so move, Madam Chair.
There's a motion to approve House Bill 6828, subject to style and amendment. May we hear a second? Julie, second. Is there any objection? Hearing none, then the motion is approved. Congratulations, Tita Marilu.
Thank you very much, Madam Chair. And Congressman Gato, thank you very much. I appreciate
Welcome, Vice Chair.
Thank you so much for everything.
We'll now proceed to House Bill number 6966, authored by Representative Wilfrido Mark Inverga, an act nationalizing Polillo Medicare Community Hospital located in the municipality of Polillo, province of Quezon, placing under the direct supervision and control of the DOH, increasing its bed capacity to 100 and appropriating funds therefore. Kong Jun, do we have Kong Mark Inverga? If none, Kong Jun, can you sponsor the bill of...
Madam Chair, in behalf of Representative Wilfredo Inverga, I would like to sponsor House Bill number 6966, an act renationalizing Polillo Medical Community Hospital located in the municipality of Polillo, province of Quezon, placing under the direct supervision and control of the Department of Health, increasing its bed capacity to 100 and appropriating funds therefore, and also move that the sponsorship, the explanatory note be adopted as his sponsorship speech. I so move, Madam Chair.
Thank you, Kong Jun. Sir Rod, may we hear a comment on this bill?
Thank you po, Madam Chair. Just to reiterate, Madam Chair, of provisions, Madam Chair, as discussed po a while ago. And then since this renationalization, Madam Chair, as based on the Executive Directive 181 for renationalization by Department of Health, so I would like to reiterate, Madam Chair, the requirements. First, the express intent of the LGU to give up its authority over the particular health facility or facilities, including its assets like human resources, buildings, grounds, records, and equipment, to the national government, particularly the Department of Health. Address the letter to the Secretary of Health and course through the corresponding Department of Health Center for Health Development or regional office. Sangguniang resolution justifying and explaining details of transfer of authority and with supporting resolutions from the Local Health Board and the Local Development Council, and information on the health facilities condition, situational analysis of the catchment area, financial and other records showing difficulty in providing resources and records of interventions, strategies, and activities the LGU had undertaken. So, and I would like also to include, Madam Chair, for the provision on the hospital development plan. Thank you po, Madam Chair.
Thank you, Sir Rod. Can we hear a motion for the approval of this bill? Do we have guests from Region 4A? I think RD Paz Janko.
Yes po.
I'm comment on this proposal, RD.
Yeah. The Polillo Community Hospital is actually situated in the municipality of Polillo, Quezon Province, and it is a 15-bed capacity. It's actually serving the municipalities of Polillo Group of Island, also called Pogi. So it includes Bordeos, Panukulan, Polillo, with a population of 28,488, 14,424, and 32,558 respectively. But it also caters patients from Humalig at Patanungan, that these are nearby island municipalities as well. These municipalities are considered as GIDA, or geographically isolated and disadvantaged areas, and started gaining interest as
RD Paz. It seems that an technical problem. Anyway, can we hear a motion for the approval of this bill, House Bill 6966? Kong Marilu.
I move for the approval.
Kong Marilu, you're on mute.
Madam Chair, I move for the approval of this House Bill. I believe it's
6966.
68.
66.
66, sorry.
There's a motion to approve House Bill 6966. Can we hear a second?
Seconded, Madam Chair.
Duly seconded. Is there any objection? Hearing none, then the motion is approved. We'll now proceed to House Bill 7074, authored by Representative Maria Fe Abunda.
Good morning, Madam Chair.
Good morning, ma'am.
My colleagues, to our resource speakers. My House Bill number 7074, the title, An Act Converting the Eastern Samar Provincial Hospital in Borongan, Eastern Samar, into the Eastern Samar Medical Center and the City of Borongan, Province of Eastern Samar, upgrading and modernizing its facilities, defining its powers and functions, appropriating funds, therefore, and for other purposes. My explanatory note, the first half of the year 2020, in the light of the COVID-19 pandemic that has greatly affected the country and the lives of many Filipinos, it has shown us and the whole country that one of the most important sectors of our society and the health sector. There is a need to better address patients' needs, the efficiency of health system, the quality and modernization of our hospitals, especially those located in the provinces. It is enshrined under Section 11, Article 13 of the 1987 Constitution that the state shall adopt an integrated and comprehensive approach to health development, which shall endeavor to make essential goods, health, and other social services available to all the people at affordable cost. There shall be priority for the needs of the unprivileged, sick, elderly, disabled, women, and children. The state shall endeavor to provide the free medical care to paupers. It provides that the government must be able to further improve health services and prioritize those who need it the most. More importantly, this should apply to for provinces and its hospitals that do not have the necessary medical equipment and supplies, medicines, doctors, nurses to cater to the needs of its citizens. In light of the growing health concerns that have affected our country and the health concerns of Filipino based in far-flung provinces such as Eastern Samar, it is imperative that the Eastern Samar Provincial Hospital be upgraded into a tertiary level 3 regional hospital. The province of Eastern Samar is home to roughly 467,160 Istihanons, whose medical needs have to be met. During the COVID-19 pandemic, the lack of medical equipment and supplies of the provincial hospital was exposed. There is not a single ventilator, nor is there a dialysis machine that is available in the provincial hospital or any other hospital within the province of Eastern Samar. Many of the residents of Eastern Samar would have to travel at least 4 to 5 hours to Tacloban City, province of Leyte, to receive the appropriate and necessary health care. It is of utmost importance that the poorly maintained facilities of the hospital be upgraded to be able to prepare the province of Eastern Samar with the necessary tools in order to overcome future health crises that may arise. These bills seek to increase the bed capacity to 300 beds and to upgrade hospital facilities, equipment, and to augment the number of personnel in the hospital to be able to cater to the needs of the hundreds of thousands of Istihanons. This will tremendously improve the delivery of the proper healthcare services to the people of Eastern Samar. In view of the foregoing consideration, the immediate passage of this bill is sought. Thank you.
Thank you, Representative Maria Fe Abunda. Sir Rod, may we hear your comment?
Thank you po, Madam Chair. Madam Chair, just to clarify lang po, Madam Chair, the intent of this bill is to upgrade the Eastern Samar Provincial Hospital and into a medical center, as well as to increase the bed capacity from 100 to 300 under the local government unit pa rin po siya ng Eastern Samar. Tama po ba, Madam Chair?
Kong Marife?
Yeah. I would like sa DOH kasi actually ang provincial hospital sa Borongan matagal na po na hirap po. Nga I do not know why na palagi ba na left behind an Eastern Samar. Nga Madam Chair, as I told you, I'm a nurse in profession, Nga I work as a public health nurse in Eastern Samar. Actually sa amin po, ang ano lang sa akin, kasi tuwing dinadala ang pasyente sa provincial hospital, ang daming wala, no medicine, yung higaan wala. Kagaya ngayon nangyari sa COVID, saan napupunta yung amin mga pasyente. Always going to Tacloban City, could you imagine? Ang Tacloban City is very far for us. Eastern Samar, wala talaga kami magandang hospital. Yun lang ang hospital na nasa Eastern Samar na medyo mayroon thermometer, sabihin na lang natin. Kasi yung mga ibang equipment talaga hindi masyado sa Eastern Samar. Iyon lang ang inaano ko po. Sana sa DOH, tingnan naman ninyo po ang mga hospital. Huwag naman ninyo kami patakbuhin pa ng Tacloban. Kaya ngayon, yung mga dialysis patient. Yung dialysis patient namin, yun, na ano pa ng COVID. Ang hirap po ng Eastern Samar. Alam po ninyo ang DOH na ang Eastern Samar is one of the poorest province in the whole Philippines. I am concerned about the health of my constituent. Sana mabigyan pa po ninyo ng pansin mga taga-DOH.
Okay, thank you, Kong Marife. Sir Rod.
Thank you po, Madam Chair. We fully support for the upgrading of the Eastern Samar Provincial Hospital into a medical center, as well as to upgrade its service capability and capacity from 100 bed to 300 beds. The DOH is fully committed based on its health facilities enhancement program, its capital outlay, while the operations as well as the PS may be charged to the local government unit, Madam Chair. As to the bed capacity, Madam Chair, that's why we are going to conduct a study po. Kasi right now, yung hospital is a level 2 with a proposal of 300 bed capacity. Kasi yung standard po right now kasi na DOH together with the DBM for the personnel services is that for the level 1 is 25 to 75 beds, while for the level 2 is from 100 beds to 250 beds, while for the level 3 is 250 to 1,500. So kaya po we need to come up with another standards specific for hospitals na pinopropose po natin na wala po dun sa existing na guidelines na initiated out ng DOH at DBM. So thank you po, Madam Chair.
Thank you, Sir Rod. May we hear an approval for bill?
Madam Chair, this is Kong Dazap. Could you please give me the honor to make the appropriate motion?
Yes, Kong Paul.
Hearing the plea of our esteemed colleague, Congresswoman Abunda, I would like to move that we approve the said bill, Madam Chair.
There's a motion to approve House Bill 7074. Can we hear a second?
I second the motion.
Duly seconded. Is there any objection? Hearing none, the motion is approved. Thank you, Kong
Paul. Thank you, Chair. Thank you sa inyong lahat. Thank you, Kong Paul Gasa. Parehas tayo mahirap.
Thank you. We'll now proceed to House Bill 7387, authored by Representative Roger Mercado, Representative Yeda Romualdez, and Majority Leader Ferdinand Martin Romualdez. Can someone sponsor this bill? Representative Paul Asa.
Thank you, Madam Chair. As the sponsorship message of the said bill, Madam Chair, I manifest that the explanatory note of the bill be the sponsorship message. Thank you, Madam Chair.
Thank you, Kong Paul. May we hear from the DOH? Sir Rod.
Thank you po, Madam Chair. I'd just like to manifest, Madam Chair, that there's a proposed also that I think that was also approved with the committee na magkaroon po ng Southern Leyte Hospital System, where in this hospital, the Salvacion Opus Iniegues Memorial Provincial Hospital is part of. So maybe, Madam Chair, we consider for consolidation po ng two measures po, Madam Chair. But nonetheless, Madam Chair, since this is a renationalization of a hospital, so as mentioned po kanina for the criteria and requirements, we support but just to comply for the requirements and for the approved provisions po, Madam Chair.
Okay, thank you. I think we need to ask the author if they're amenable on consolidating this bill with the other bill. Okay, since the authors are not present, we need to ask their position on the proposal of the DOH. What do we do on this bill, ComSec? Should we defer the approval or Sir Erwin?
Good morning, Madam Chair.
Erwin.
Good morning, Madam Chair. This is Erwin po.
Yes.
We respectfully suggest, Madam Chair, that we defer first the approval of which, then we
Yes.
will immediately get in touch with the authors.
Okay.
Thank you, Madam Chair.
Thank you, Sir Erwin. I think we need to defer the approval of this bill until we get the position of the authors on the recommendation of the DOH, since we have pending bills in Leyte, I think. Can we hear a motion for the deferment of the approval, Kong June?
Madam Chair, I move to defer the approval of House Bill number 7387, pending the presence of the principal authors. I so move, Madam Chair.
Thank you, Kong Chun. There's a motion to defer the approval of House Bill number 7387. Can we hear a second? Duly seconded. Is there any objection? Hearing none, then the motion is approved. We'll now proceed to House Bill number 7408, authored by Representative Rani Abu, entitled "An Act Converting the Mabini Community Hospital into the Municipality of Mabini, Province of Batangas into Level 1 Tourism Specialty Hospital to be known as Mabini Medical Tourism Hospital, increasing its bed capacity to 50 beds and appropriating funds therefore." Kong Rani Abu.
Thank you very much, Madam Chair. I thank you very much to your Secretariat for calendaring this House Bill 7408 and pay part of the agenda today's meeting. First, I would like to move that the explanatory note of House Bill 7408 be my sponsorship speech. Then second, furtherly, Madam Chair, would like to mention that the Mabini Community Hospital was funded by some funds from 2017, funds from the House of Representatives and House of the Senate General Appropriation Acts, and some were contributed by the private sector, like the San Miguel Corporation, because San Miguel Corporation has, if I'm not mistaken, 3 subsidiary companies there in Mabini, Batangas, and they contributed to build some buildings there to be part of the Mabini Community Hospital. Why? Yung pong Mabini Community, yung pong Mabini, Municipality of Mabini, Batangas, Madam Chair, ay alam po naman natin, sentro yan ng turismo doon sa 2nd District at maging sa lalawigan ng Batangas, lalo na pa sa usapin ng scuba diving. At sa totohanan lang, itong 2019 alone, meron po tayong 363,109 tourist arrivals at 32,277 out from that ay foreign travelers. So talagang marami pong turista diyan. Pero ang iisa lang yung hospital diyan na private hospital na wala pa 20 yung bed capacity ng private hospital, then wala na. Then yung nearest na government hospital at nearest na private hospital diyan sa Municipality of Mabini ay 10 kilometers away doon sa pinaka-town proper. Then meron doon yung katabi na island municipality, the only island municipality in the 2nd District of Batangas, na 45 minutes away, boat ride, mula dito sa town proper ng Mabini, na wala rin naman ng ospital. Katunayan, may rural health unit doon, nagbibigay ng pontong Department of Health, pero wala naman makatigil ng mga medical practitioners doon sa Municipality of Tingloy. Kaya problema talaga ho diyan ang health services sa dalawang bayan na yan, Tingloy at Mabini. So, ngayon, pag may mga na-aksidente diyan ng mga turista, wala, takbo doon sa iba't ibang takbo sa bayan ng Bawan, bayan ng San Pascual, hanggang Batangas City para lang ma-actionan at ma-treat yung mga na-injured o na-aksidente ng mga turista diyan sa bayan ng Mabini. Nung pong si Director Hanairo ang regional director ng Department of Health na pag-usapan namin, ang kailangan talaga magkaroon. Kaya nga noong 2017 sa pangunguna ni Mayor Noel Luistro, napag-agreehan namin na pagsama-samahan namin, pagtulungan namin na magkaroon ng government hospital. But hanggang sa naitayo yung mga buildings na yan, lumipas ang 3 taon, 2 taon, 3 taon, hindi yung makapag-function dahil alam po naman natin ang limitation ng personnel services diyan sa local government units. 45-55% ng internal revenue allotment, din natin, yun lang ang laan para sa personal services. Sobra na po, hindi na po kaya ng municipal government. Salamat po sa Bayanihan 1 and Bayanihan 2. Salamat sa Department of Health. Nag-function ngayon ang Mabini Community Hospital, catering, lalo na yung mga mayroong symptoms ng COVID-19 at saka yung mga iba pa hong sakit na related sa mga sintomas ng COVID-19. So talagang sinuportahan kami ng Department of Health. At tingin namin, after ng Bayanihan 1, Bayanihan 2 funds, hindi na magpa-function yung Mabini Community Hospital. Kaya talagang pinipilit namin na makiusap sa inyong committee at sa iba pa ng mga kasamahan natin, lalo na sa Department of Health, na itong Mabini Community Hospital ay maging i-manage na, i-supervise na ng Department of Health at gawin itong sa level 1 hospital, i-increase ang bed capacity nito from 18 to 50 at mag-appropriate na tayo ng pondo talaga ang Department of Health mula sa National Government, General Appropriation Act, para naman makapag-function ito at magpatuloy po yung health services natin, hindi lamang sa bayan ng Mabini, kundi sa bayan ng Tingloy. So on that note, Madam Chair, before I end, gusto ko lang din i-recognize na rin ang ating officer in charge ng Region 4A Department of Health, si Director Paso, si Moko, at narin din po yung aming officer in charge ng Mabini Community Hospital. At the same time, siya po yung ating municipal health officer, si Doktora Mila Biloso ng Municipality of Mabini. Madam Chair, and to the rest of the members of the community, nahingi po ako sa inyo ng suporta, nahingi po ako sa inyo ng pakiusap na ma-aprobahan po natin immediately ito pong House Bill 7408. Thank you, Madam Chair. Thank you to the members of the committee.
Thank you, Kong Rani. Sir Rod, may we hear your comment?
Thank you po, Madam Chair. We fully agree with the intent of the bill to upgrade as well as to ensure the continuity of the operations of the Mabini Community Hospital, presently under the local government of Batangas, I think. With this, Madam Chair, since it is a renationalization, Madam Chair, and since we refer to the criteria mentioned as well as the supporting documents, and as well as the provision on the appropriations to consider po, Madam Chair. And maybe, Madam Chair, for the authors, if he may also agree, to include provision on the hospital development plan. Because currently po, the DOH has no standards specific for the specialty hospital catering tourism. So with this, we need also to further look into what are the appropriate service capability as well as the bed capacity for the hospital for the proposed upgrading of the hospital. So maybe we can have this leeway po to for the Department of Health to ensure appropriate bed capacity as well as the capability of the hospital.
I think, Director Oda, Madam Chair, fully agree po ako diyan, wag lang makaka-delay sa approval ng ating House Bill na yan. At saka I think this will be the first sa sistema ho natin na magkakaroon kayo ng convergence ng Department of Tourism. Magkakatulungan kayo dito. Magiging first ito na pwede natin maging modelo ito sa iba pang mga municipalities na may mga tourism industry. And for your information din, Madam Chair, and to Director Napulan, yun yung Department of Tourism, only last month to, naglagay ho diyan ng isang hyperbaric chamber para ho doon sa mga nag-scuba diving. So talaga ho, natulong na rin ng Department of Tourism para ho diyan sa services ng ating hospital na yan.
Okay, thank you, Kong Rani. Maybe here a motion for the approval of House Bill 7408.
Madam Chair, Kong Dasha. Yeah, please allow me to make the motion to approve the said bill of Kong Abu, Madam Chair. I so move.
There's
I
a
second the
motion
motion.
to approve House Bill 7408, duly seconded. Is there any objection? Hearing none, the motion is approved. Congratulations.
Maraming salamat po, Madam Chair. Maraming salamat sa kababayan kong Congressman na Paul Dasa, Representative
Abu.
Dasa. Maraming
Thank
salamat
you,
po.
Kong Abu.
Thank you.
Good job. Good job.
Would like to turn over the chairmanship to Representative June Gato to give way on my sponsorship of the last bill.
Thank you, Madam Chair. Good morning, ladies and gentlemen. We now listen to Chair
House Bill 801.
Chair Angelina Tan for her House Bill sponsorship.
Thank you, Chair June Gato. Again, good morning. I'd like to sponsor House Bill 8048, which seeks to upgrade the Alabat Island District Hospital in Alabat, Quezon, into Level 3 General Hospital to be known as the Alqueres General Hospital under the direct supervision and control of the DOH. So, katulad po nung bill ng Polilio Medicare Community Hospital, ni Kong Mark Inverga, ang Alabat Island ay composed of 3 municipalities, Quezon, Alabat, and Perez. Hence, we call it Alqueres General Hospital. And currently, ang means of transportation lang po talaga dito is through boat, no? Although may ongoing construction of the bridge connecting this island to the mainland in the municipality of Quezon and Lopez Quezon, ang Alabat Island is a center of tourism, just like the Mabini in Batangas, no? So, and we are promoting this island din po talaga this time. So, there are ongoing development in the island, and alam natin na necessity talaga yung access to health facilities. So, currently, ang hospital ay level 1, and we only have, I think, 2 doctors in the hospital. At nakita natin na nakakaawa yung mga kababayan natin dito sa isla na nagkakasakit. Kung kaya, I'm proposing for the renationalization of this hospital because for a long time, ay hirap na po ang ating mga kababayan sa access to health services. And we are na-envision namin na in the long run that mas dadami pa ang mga tao dito sa isla nito because of the opportunities na meron doon sa isla because of the current development. So I'm seeking the help of the committee members for the approval of this bill, House Bill 8048. Thank you, Mr. Chair.
Thank you, Chair. May we hear from the Department of Health, Sir Roderick?
Thank you po, Mr. Chair. Mr. Chair, would like to reiterate the request for the submission of the documentary requirements for renationalization as well as provision on the appropriations po, Mr. Chair. Although it's already reflected on the hospital development plan, the hospital development plan will be part of the proposed measure. Would like to inform Mr. Chair that the since level 3 po yung proposal ni Chair, maybe we can consider po the wording tertiary na lang po muna, so that level 2 muna, and then if we have at least level 2 or tertiary term, then later on if there's a available specialist as well as a training program for the hospitals, then we will convert that or improve that to level 3. So if okay po kay Madam Chair po.
Madam Chair, the author.
Yes po. I am amenable to the amendment being proposed by the DOH, Mr. Chair.
Okay. Do I hear a motion for approval? The bill?
Mr. Chair,
I move.
Yes, Kong Paul.
I move that the said bill as amended be approved, Mr. Chair.
I second the motion.
Any objection?
There is
Here-
none.
Hearing none, the motion is approved. Congratulations, Madam Chair.
Thank you, Mr. Chair.
I now turn
Mr.
over
Chair.
the chairmanship to Madam Chair.
Thank you, Kong Jun Gato. Before we end this hearing, may we hear from the DBM, DBM's comment, kasi nandito na po si Ma'am Jane Abella on the renationalization bills. Ma'am Jane?
Yes, ma'am.
Yes.
Thank you very much, ma'am, for giving us the opportunity to present our comments, ma'am. Akala namin, ma'am, hindi niyo na kami tatawagin eh.
Tatawagin kita, ma'am, last.
Hindi, ma'am, kasi ganito, ma'am. While we note na na-approve na po siya ninyo, allow us, ma'am, to present or to discuss yung letter ho ng DBM sa ating Legislative Executive Development Advisory Council na dated no December 6, 2019 po. Pwede ho naming basahin?
Sige, ma'am. Kindly read po.
Medyo ho, we beg your understanding na medyo ho 2 pages ho yung letter. Pwede ho ba namin basahin? Or bigay lang namin yung gist?
Yung gist na lang, Ma'am Jane. Ma'am Jane, is this the one you discussed with DOH concerning House Bill 7322? On
Yan
the
ho, ma'am, yung kay
appropriation?
Congressman Dimaporo.
Yeah, yan, kung kay Congressman Dimaporo.
Ma'am, actually, ma'am, at the time na nagde-discuss with in the Senate for the concern of Congressman Dimaporo, we do not have yet the letter sent by DBM to the LEDAC. This was just recently given to us by our senior officials, and we were given a clearance that we can already discuss this one in Congress, to your honor.
Okay, Ma'am Jane, can kindly proceed po. Yung
Yes,
gist
ma'am.
lang po of that position
ma'am.
of the DBM.
Actually, ma'am, ang ano lang namin dito, ma'am, is portion na lang po, ma'am, kung pwede babasahin ko lang po, no, para makuha mismo yung mismong content po ng letter.
Okay, please proceed.
Yeah, ma'am. We write, the letter is addressed to Secretary Pernia. At the time, he was still the NEDA head. We wish to express our concern for the increasing number of the filed bills seeking for the renationalization of the devolved functions of the local government units, thereby amending Local Government Code of 1991. In 2022, the Supreme Court ruling on the Mandanas-Garcia petition to base the computation of the just share of the LGU's internal revenue allotment from all national taxes shall take effect. Based on the projected 2019 revenue collection, this will imply some 270 billion of additional ERA, or 30% more being distributed to the LGUs. The increase in the ERA will effectively reduce the national government fiscal space to ramp up social programs and infrastructure projects by about 5% of the government disbursement and 1% of the country's projected 2022 nominal gross domestic product. On the other hand, an increase in the ERA in 2022 is also an opportunity to strengthen the fiscal capacity of the LGU to deliver crucial and basic services to fulfill the potential of the LGU to empower communities through decentralization. The DBM, together with the Department of Interior and Local Government and the National Economic Development Authority, are currently developing a transition plan to further devolve the functions identified in the LGC and capacitate the LGUs. In this light, DBM expresses our concern that if the aforementioned set of rationalization bills at the time that were submitted at the time would progress through the legislative process, it will not only undermine our current efforts in empowering LGUs, and increase the fiscal pressure on the national budget, but would also likewise run counter to the President's vision of effective decentralization to the region. Yun po ma'am ang aming yun po ang letter ng DBM sa NILEDA.
Which means, hindi nyo directly sinasabi na dinidiscourage nyo ang renationalization. Pero yun po ang gustong puntuhin ng inyong posisyon. Ma'am Jane.
Yes, ma'am. Ma'am, ang ano lang kasi natin, ma'am, is meron ho kasi siyang magkakaroon ng effect sa ating fiscal position kasi nga ho,
Because
as I
of the
mentioned, mga 270 billion po ang mata-transfer from the national to the local government unit. So it may also affect yung DOH budget po natin once na nag-nationalize po tayo. Ma'am, can you allow our director from the Local Government Regional Coordination Bureau to discuss ano na ho yung extent ng ating yung preparation for the devolution? Si Director Aris po. Can you allow him to speak?
Yes, yes. Director Aris.
Thank you very much, Madam Chairperson. Good morning, everyone, to the other members of the committee and the two sponsors. Magandang umaga po sa inyo lahat. Yes, Director Jane Abella is correct that we discourage for the rationalization of functions from the local government units, the national government, primarily because of the fiscal implications brought about by the Supreme Court decision in the Mandana case. So our position po, well, first and foremost, allow me to inform you that will formally submit its position paper on the legislative measures. And initially, I think I can already mention this because we are consistent with our position that the guiding principle and the general direction should be towards devolving more and more functions and services and facilities to the local government units, commensurate to the projected increase in their internal revenue allotment shares as a result of the implementation of the Supreme Court decision in the separate petitions filed by Governor Hermelando Mandanas and the late Governor Enrique Garcia of the province of Bataan. So as you know, the Supreme Court has already rendered a final and executory decision on those two petitions, which effectively directs the national government to include all national taxes in the computation of the ERA shares of local government units, which ultimately will result to an increase of around 234 billion based on the latest estimates of the BIR to the ERA shares of the LGUs. And consequently, that will also be the amount of the decrease in the available fiscal resources of the national government. So one of the most viable measures identified by the economic managers, well, I am referring to the DBM, DOF, and NEDA, together with the DILG, is to fully devolve the functions and services to the local government units, consistent with Section 17 of the Local Government Code of 1991. So we are already in the process of formulating the transition plan that will set the direction for this full devolution, and we want it sana to be done through an executive order that will be issued by the President. The executive order, the draft executive order has already been drafted by the Department of Budget and Management and endorsed it to the NEDA, DOF, and DILG for joint endorsement to the Office of the President. So that is the status quo of the transition plan, which clearly is not in line with what is being proposed now in Congress for the renationalization of functions, including those for health services. That's all, Madam Chairman. Madam Chairperson, thank you.
Thank you, Director Aris. Ang problem, Director Aris, no, with that Mandanas law, you mentioned 30% of that fund will go to local government. Yeah, tama po, sir. Okay.
Based on the latest computation, Madam, it will be around 27.61% increase based on what they are supposed to get in 2022 as compared to what they will get as a result of the implementation of the Mandanas ruling. So, and that is equivalent to a nominal figure of 234 billion pesos.
But when it comes to health, so nag-increase ng 27%. When it comes to health, Ang worry ko dyan, sir, hindi mo naman madidiktahan ang LGU paano niya gagamitin yung 27%. Okay? Mabuti sana kung ang desisyon ng Supreme Court, sinabi nila na part ng mababawas doon sa DOH that will be distributed to the LGU will be specifically used for health. Hindi po ba? So yun, I don't know, hindi natin ma-prevent our members from filing legislations on renationalization kasi nga iba-iba naman ang priorities ng LGU. So we'll see no in 2022 on how they're going to use that 27 increase on their budget, kung who among the local chief executives will prioritize doon sa funding allocation nila based on the increase on health. So yun yung magiging problem namin dito sa Kongreso, no, kasi nakikita ng members na sa DOH lang yung or national fund lang yung may malaking pwedeng pagkunan to improve the healthcare delivery system. Kong Paul, want to say something? Kong Paul?
Yeah. Madam Chair, I wanted to ask DBM because we're getting conflicting information. So because I had heard from other sectors that the national government may not be implementing in 2022 the increase in ERA. So can we clarify from the DBM if the direction will be to implement the Supreme Court case effective 2022?
Yes, sir. Presently, we are on track of implementing the Supreme Court decision starting with the 2022 budget cycle as mandated by the Supreme Court in its final and executory decision on April 10, 2019. And in fact, we have already finalized the proposed executive order that will set the direction for the full devolution of functions and services to the local government units, and we have already submitted the proposed executive order to the Department of Finance, NEDA, and the ILG for their final comments before we finally forward it to the Office of the President.
Madam Chair, can we hear from the DBM?
Kong Paul, si Sir Aris is from the DBM po.
Okay. They're both from DBM. There's someone who spoke earlier.
Si Ma'am Jane is Assistant Director.
Yeah. Okay. Well, can I ask the Assistant Director who just spoke, have you had recent talks with the Department of Finance? Because the DOF Secretary, as you know, have already said that they may not be able to implement the increase. And if they do, Madam Chair, one of the options is to have a corresponding set of services agreed upon that will be transferred to the LGU. So can I ask the Assistant Director if they have had recent discussions with the Department of Finance on this?
Sir, Your Honor, sir, this representative is not part of the group that is undertaking the series of actions being made on the devolution. It would be best for Director Aris to discuss that, sir, kasi hindi ho ako kasama sa member of the body or the group taking charge of the devolution in DBM.
What's the name of the group, Madam? What's the name of the group in DBM in charge of that?
Sir, actually, Director Aris is in charge, is the one handling the local government regional coordination bureau. So they're the one more of authority on the actions being made now by DBM relative to the devolution to comply with the Supreme Court ruling.
Yeah. Okay. So has there been discussions with the DOF, and could you confirm that that's the intention, is to implement the Supreme Court case?
Madam Chairperson, may I be recognized to respond to the concerns raised by Governor Daza, Representative Daza?
Yes, Director Aris.
Thank you, Madam Chair. To the honorable congressman, we are not aware of that statement coming from the Secretary of Finance about the supposed non-implementation of the Mandanas ruling. But as far as we are concerned in the DBM, we have continuing discussions with the members of the technical working group composed of the DBM, DOF, DILG, NEDA, together with the Local Government Academy and the Development Academy of the Philippines, Civil Service Commission, and the Presidential Communications and Operations Office. So it's actually the TWG composed of those agencies that promulgated the executive order, which is intended to provide the principles and general guidelines in the full devolution of functions to the local government units come 2022, which is the pilot year of implementation of the Supreme Court ruling in the Mandanas case.
Okay, Madam Chair, my suggestion is because it's still a little tentative, but for our purposes in this committee, Madam Chair, because healthcare is obviously is of the highest priority in this committee, and rightfully so. One discussion that we may have in the committee, Madam Chair, is should the executive branch decide to implement soon, and it's going to be soon because their budget call for 2022 will take place towards the end of the first quarter of 2021, and that's only basically 3-4 months away, is to have a discussion on how to include healthcare, improving the healthcare services in the LGU and tying that in as maybe as a one of the priority programs to be funded in the increase of ERA for the LGUs. And to share, Madam Chair, I personally heard the good secretary of the Department of Finance state publicly at one event that possibility of tying in the increase to certain devolved services as part of the as part of the implementation of the Supreme Court case. So maybe we can find a way to include healthcare and these issues and these bills that we just approved, in the committee, Madam Chair.
Thank you, sir. Kindly take note, Sir Aris, no? And can you furnish us the copy of that recommendation? Is that final?
Yes, Madam Chairperson, we will submit our position and comments on the proposed measure. But just to respond to the suggestions of the Honorable Congressman Naza, may be allowed to say some points, Madam Chairperson.
Go ahead, Director Aris.
Thank you po. So I think one salient feature of the transition plan that we are preparing is the preparation of devolution transition plans by the national government agencies, including the Department of Health, when it comes to the devolution of health services to the local government units. The preparation of devolution transition plans by the national government agencies is intended to provide a more strategic devolution of functions, programs, and facilities to the local government units. The devolution transition plans that will be prepared by the national government agencies will include the specific programs and projects to be devolved per level of LGU. I'm referring to the per level of province, city, municipality, and barangay. The definition of standards for the delivery of devolved services, which will include the minimum cost, the scope of services that will be devolved, and the quality of services. So there will be standards that will be prescribed by the Department of Health in the case of health services that should be complied with by the local government units. There will also be a strategy for the capacity development programs for the local government unit personnel, and we are coordinating with the local government academy for this purpose. And then there will also be a framework for the monitoring and performance assessment of the local government units, which will include the imposition of sanctions provided under pertinent laws. So there will be an accountability on the part of the local government units that will not deliver the functions and services as mandated under the local government code. And finally, on the part of the Department of Health, they will also be required to prepare an organizational effectiveness proposal which will contain modification in the organizational structure and staffing complement of the bureaus and other offices under the Department of Health and other national government agencies affected, that will basically strengthen their capacity in assuming steering functions. So yung steering functions nga po na yon is basically about the provision and setting up of standards that should be complied with and serve as the guidance for the local government units in their service delivery.
Madam Chair. Madam Chair.
Kong Rani.
Please
proceed.
May tanong, sige. Director Aris, Director ba o Assistant Secretary? Director?
I'm an OIC Director, sir.
Okay. Director Aris, 100% ba ninyong i-implement yung Supreme Court ruling sa 2022?
So far, sir, ganun po yung ginagawa namin. We will fully comply with the Supreme Court ruling.
So, it's 100%. Not hindi yung halimbawa, ang increase ng ating projected income for 2022 is 8%. So 8% muna yung gagawin natin implementation ng manda na suling. Hindi ganon, kundi 100% agad. Kung 27% yung idadagdag natin, 27% agad. Ganun ba?
The implementation, sir, will be based on the directives as contained in the Supreme Court decision and based on the formula in computing the ERA as provided under the local government code. That is, for 2022, we will base the ERA shares of the local government units in the actual collection of national taxes in 2019. Right, 3 years preceding po when it comes to computation of the ERA. So we will fully implement that, sir. For example, if the collections of national taxes in 2019 is 2.8 trillion, then we will just remove all the authorized deductions like those intended for the local government units, like their shares from the national wealth and the other special accounts po mandated under the law. Then the net amount will be the basis in the computation or in the determining of the equivalent of the 40% of those national taxes. Kasi yun po yung formula under the local government code.
So yun ang magiging basis. So yun ang magiging
correct,
basis ninyo kung bakit dinidiscourage ninyo yung renationalization ng mga health services natin dahil niisip ninyo talaga, pino-project ninyo 100% yung gagawin ninyo na implementation ng Supreme Court ruling. Tama ano?
That is correct, sir. It will.
Okay. So medyo mag-aaway tayo tingin ko diyan sa susunod. Nariyan si Kong Dasa. Tingin ko humanda kayo, mag-aaway-aaway tayo diyan sa appropriation. Why? Ang mga devolved functions natin sa ng national government to local government units is environment, agrarian, agriculture, education, social services, health. Marami yan. But like sa environment, dinevolve na yan sa local government units, pero meron kayong PENRO, meron kayong SENRO. Meron tayong mga ganon. May mga provincial officials kayo under ng kan. Sinasabi mo nga kanina, titingnan ninyo, i-align ninyo yung mga bureaucracies para maayos natin yung kan. Ibabalansin ninyo. Ngayon, kung hindi rin 100% naman na inyong i-implement yung ating Supreme Court ruling, tapos hindi 100% ninyo na ibabalanse yung sa national, medyo magulo tayo diyan. Siguro ihanda ninyo yung sarili niyo, ihanda ng DBM. Hindi ito yung proper venue para pag-usapan yan dahil committee na ito. Ang proper venue natin, Committee on Appropriation, paghandaan ninyo yan. Dahil titingnan namin yan, mga devolved functions na hanggang ngayon, may mga devolved functions, pinipilit ninyo, wala na tayong pondo riyan sa local government units. Babawasan na namin yan dahil na-devolve na namin sa inyo yan. Pero may mga tao pa rin kayo na yung inyong yung mga government agencies natin na mga dinevolve natin sa local government units, yung structure natin, palaki pa rin ng palaki sa national. Hindi naman tayo nag-rationalize na yan. So, pag-usapan natin yan sa appropriation.
Thank you, Kong Rani. Director Aris, can you send us a copy of that local transition development plan? Can you furnish the committee?
Yes, Madam Chairperson, we will submit a copy of the latest draft of the proposed executive order about the transition plan.
Okay. Thank you. And the transition plan itself, no? We want to study also yung what's in that transition development plan.
Madam,
Director Aris.
Actually, the executive order, Madam Chairperson, is already the transition plan that we are proposing.
Okay, thank you. Last, Kong Paul.
so Madam Chair, could we request a copy of that once it's submitted to all the members who are here this morning? Second, let me echo what Kong Abu, Rani Abu, mentioned earlier, and he hit it right on the head. That we're gonna need a lot more discussion on these issues, and this may not be the right forum as it relates to the total, the total scope of the increase of the budget, and Ways and Means or Appropriations Committee might be the better venue. But thirdly, Madam Chair, because we're so passionate about healthcare, and I think you heard from our colleagues how in many areas there is really a need to ramp up the healthcare services. I think my suggestion, Madam Chair, to the committee and to our chairwoman, maybe in the next committee hearing, if we can have a more some sort of discussion on this, because there is a possibility that the ERA increase will be implemented in 2022. I'd like to explore how we can find ways, options, on how to inject the healthcare advocacy with the LGUs, given the fact that I think Director Aris mentioned that there will be devolution services that they're going to be supporting. I like what I heard, Madam Chair, about setting forth guidelines and performance standards, because I think that's one of the critical points that need to be included in a discussion with the LGU healthcare services. So I think there are good things that I heard from the DBM that we should keep on discussing and maybe find ways on how to affect the healthcare policy that will improve healthcare services at the LGU level, Madam Chair. So I guess my suggestion is to maybe at the next meeting include in the agenda this particular discussion.
Thank you, Kong Paul. Comsec, please take note on the proposal of Kong Paul Daza. May we hear our favorite motion?
Move to adjourn, Madam Chair.
Thank you, Kong Jun. There's a motion to adjourn this meeting, duly seconded. Is there any objection? Hearing none, motion is approved. Thank you so much to our resource persons. Director Aris, thank you so much po. I hope na maka-attend kayo sa next mga hearings namin together with Ma'am Jane. Congratulations to all our authors.
Thank you, Ma'am. Good afternoon, Ma'am.
Yes, enjoy your lunch.
Comsec, maybe you can invite the DOF also. Comsec, if we do have a discussion as a suggestion, Madam Chair.
Comsec.
Noted po, Madam Chair. We will comply po.
Yeah, also the LGU, I think, very important.
Yes, Madam Chair.
Yeah. Thank you so much.
Thank you.
Thank you, Comsec Erwin. Thank you, everyone.
Thank you, Madam
Salamat din
Chair.
po.
Thank you for everything.